Are melatonin supplements safe for your child? Hi, I'm Dr. Mona, a board-certified pediatrician and mom, and we're discussing melatonin supplementation in children and important things to consider when choosing to give your child melatonin. Let's get to it. Melatonin is a hormone that is naturally produced by a gland in your brain called the pineal gland. It's most commonly known to help with sleep because it is produced in response to darkness, so it naturally increases in the evening and helps to promote sleep at night. The hormone helps you to fall asleep, not necessarily to keep you asleep. Melatonin connects with your circadian rhythm, which is your internal clock. This works to establish your daily sleep-wake cycles. It is thought that melatonin has other important functions beyond sleep, but more research is needed to understand these functions better. Melatonin can be synthetically created and provided in the form of supplements. These supplements are commonly marketed to promote sleep, suggesting restful, relaxing, or longer sleep. The melatonin available for children is often in the form of gummies, liquid, or chewable tablets. These can be available over the counter or by prescription. A recently published review and analysis of the literature in 2023 evaluated the use of melatonin in children and adolescents with idiopathic chronic insomnia, or those children and adolescents who have sleep problems without any known cause. The review and analysis included 8 randomized controlled trials with a total of 419 children and adolescents. When the trials were evaluated together, the evidence suggested melatonin is effective in increasing sleep time by 30 minutes per night and in decreasing sleep latency, or how long it takes to fall asleep, by 18 minutes. These results are based on a few studies with small sample sizes and rely on the reports of parents or participants themselves. So although this is helpful and valuable information, it's still really important to interpret it with caution. The clinical recommendation is that melatonin should not be used as a first choice for sleep aid for children. Another review and analysis published in 2019 included trials that evaluated melatonin use in children with neurodisabilities. A total of 13 trials were included in the review and analysis. It was disclosed that many of these trials were at high risk for bias and of poor quality. Overall, there was an increase in reported sleep time compared to those who were not given melatonin, but the extent of the benefit, which children might benefit the most, and the clinical significance were not clear. These results suggest that melatonin can be effective in children with neurodisabilities, particularly in those with autism spectrum disorder. The review also concludes melatonin was well tolerated with minimal adverse side effects. These results still need to be interpreted with caution, given the quality of the studies included. The authors of these studies conclude that the results support existing recommendations that melatonin should only be used where sleep problems continue after other efforts to improve sleep were not successful. Overall, the research on melatonin use in children is limited. This is often the case for some things in pediatrics, so we don't have strong research to support the efficacy or safety of melatonin, but choosing to give it may be a case-by-case basis based on your child's needs. Let's go over important tips before you supplement with melatonin. If your child has trouble falling or staying asleep, we want to dive deeper into this concern and find out if there is another reason why. So if you have concerns about your child's sleep, this is an important conversation to have with their clinician. There are medical or behavioral conditions to assess for and rule out, such as sleep apnea, ADHD, or anxiety. This podcast episode with Dr. Shelby Harris is a good listen. We also want to make sure sleep hygiene is adequate. The overuse of screens and tablets can interfere with the body's natural melatonin production. Other sleep hygiene considerations include bedtime routine, daily schedules, and parental approach to sleep boundaries. The importance of sleep hygiene cannot be understated. For older children, sleep may also be affected by stress, screen time, physical activity or lack thereof, and school events. If other causes for sleep issues have been ruled out and additional strategies to improve sleep have failed, your child's clinician can help advise you on melatonin for your child. According to the American Academy of Pediatrics, when dosing melatonin, it's best to start with a low dosage and evaluate the effectiveness and side effects for your individual child, as we all metabolize these things differently. Melatonin dosage and timing depends on how and why you plan to use it for your child. Many children will respond to a low dose of 0.5 milligrams to 1 milligram when it is taken 30 to 60 minutes before bedtime. According to the AAP, melatonin is most commonly considered for short-term use. For example, to help children get rest while establishing a good bedtime routine, or with older children and adolescents resetting their schedules, such as after vacations, summer breaks, or other sleep interruptions. Longer use of melatonin may be recommended depending on the clinical situation and sleep habits of a child and other diagnoses. Typically, a child will adjust to time change like we as adults do. You may even have to plan ahead and slowly push your child's bedtime forward or backwards in 15-minute increments depending on when the time is changing. But if your child is more sensitive to sleep changes, discuss short-term melatonin use with your child's clinician to see if the benefit is there. This can be a case-by-case basis, but melatonin can be something you consider if your child doesn't adjust as quickly to time change or you are traveling frequently across significant time zones across the world. Generally, children adapt to time change as adults do, so if you're not taking melatonin, I highly suggest you're not giving your child it. When thinking about the side effects of melatonin, the most commonly reported side effects include morning sleepiness and drowsiness during the day. It's also important to remember that melatonin may interact with other medications, so be sure to discuss giving your child melatonin with their clinician or pharmacist to check for interactions. It's generally accepted that melatonin is relatively safe for short-term use. However, there is less certainty about the long-term use of melatonin. Therefore, we always look at benefit and risk and looking at each individual child, their sleep habits, and what else we have tried before using melatonin. It's also important to remember that supplements in the US are not evaluated by the US FDA for safety. This means there are likely no additional regulations or testing outside the company creating and selling the supplements and us as consumers trusting their products. A research study evaluated melatonin gummies and measured the amount of melatonin from 25 samples. The results showed a wide range of melatonin dosages despite label claims. The gummies that contain melatonin dosages range from 74% to 347% of the labeled dose. Overall, 22 of the 25 samples analyzed were incorrectly labeled. Unfortunately, we don't have a list of which brands these were. This shows how crucial it is to discuss melatonin with your child's clinician and choose a trusted brand with integrity and always look at benefit versus risk when taking medications and supplements. It's also important to avoid accidental overdoses with melatonin gummies by keeping it away from reach from children. One study reported that between 2012 and 2021, there were over 27,000 emergency room and clinic visits, over 4,000 hospitalizations, over 275 ICU admissions, and 2 deaths from melatonin ingestion. While melatonin can be helpful for short-term sleep issues in kids and for some children in long-term use, including those with neurodiversity, it's important to use it cautiously and only under the guidance of a healthcare provider. And don't forget to focus on creating those healthy sleep habits and routines first. If sleep problems persist, consult your child's clinician to explore safe solutions that may include melatonin supplementation. I'm curious, have you used melatonin with your child? Did you feel like it helped? Have other questions about melatonin in children? Comment below and subscribe to this channel to stay up to date on future content. And if you found this video helpful, give it a thumbs up sign and share it on social media. I hope I brought more confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.